Hi, we're back with another NHS Wellness podcast, and today my guest is Dr. Jim Smith. He is our surgical oncologist. So let's talk about where you grew up. You grew up in Mexico.
Right. I grew up in 3 or 4 different areas in Mexico from the time I was 3 years old to the time I went to high school. Really, my junior year of high school, I was in Mexico, and went back for vacations and everything else. So Spanish and English were really sort of my first language at the same time. I never really learned one or the other. It was just that they were what I spoke all the time and still do. So Spanish is a language that I'm very comfortable with because when in Mexico at home we were expected to speak English and speak Spanish everywhere else. And when we would come back to the States, my parents were very smart. They would make us speak Spanish at home, and that way we never lost it.
Oh, that is good. So what made you want to specialize in oncology?
I had always planned, and I actually went to medical school with the idea that I would go into cardiac surgery. Mm-hmm. That was what I always wanted to do. I'd seen major stories on people like Christian Barnard and Cooley, and I just wanted to do that. So that was my plan. But my 4th year of my residency, I was given the opportunity to spend 4 months at Memorial Sloan Kettering in New York, doing really a rotation in cancer surgery. Fell in love with it. Was fortunate enough to be chosen to do my training there, and I've loved it ever since.
So today I want to talk to you about how long have you been doing this?
I finished my training in 1991, so a very long time.
Very long time. And what services do you do?
Here at NHS, I provide general surgery services and surgical oncology. So my primary interests have always been hepatobiliary pancreatic, but we provide everything from breast surgery, then pretty much any kind of intra-abdominal kind of malignancies except for female type things and urology.
So when you say we do breast surgery, so we do mastectomies, but we have the capability of doing the reconstruction surgery here.
Right, so the majority of our patients that we do breast surgery on for cancer, we're able to do breast conservation, so they will get pretty much a minimally type approach. So we'll do a lumpectomy, sentinel node biopsy, which is using a dye and a radioactive material to identify the very first node that might be involved in the patients, and if that's negative, then that's where we stop, and then they have radiation therapy. So that's really pretty much the standard of care right now. There are patients who will just have a far more advanced breast cancer that we really can't do that to, or they just don't want to go through the radiation therapy and things like that. In that case, we will provide the mastectomy. In the event that the patients want reconstruction, we now have the ability to do that here on site.
Well, there you have it. That's Dr. Jim Smith. We are ready for all of your cancer needs. He can take care of them here at Northeastern Health System. You would just need a referral.
Right.
Correct? Referral from your PCP.